Hi and welcome. My name is Leda McDaniel, and I'm so excited to be joining you all for your yoga teaching training and teaching a small segment on applying anatomy and biomechanics to your yoga practice. I am a physical therapist here in Atlanta. I also teach within the physical therapy department at Emory University, and I am a board-certified orthopedic clinical specialist and just have a really big passion for anatomy and movement practices. And so what I'd like to do within this lecture today is kind of orient you to some of the terminology that we will be using in person in class and some of the basic principles so that we can get the most out of our in-class and in-person time. So I hope that you can follow along with me. If you have questions, please bring them to class. And I look forward to working with you all. So within this kind of mini course for your yoga teacher training, what I'd like to present is some introductory principles today. And then we're going to go through a 3-part series where we kind of break down anatomy at different joints of the body and their associated muscles, movements, actions, all with the goal of applying these principles to yoga postures and the yoga practice so that it is applicable to what you are learning and instructing students in the poses, but also so that you have an understanding of these things, not just in a static way, but in a very movement-oriented and useful and applicable way. So we're going to kick off today just with some of the introduction so that we are all on the same page as far as language, terminology, planes of motion, and just some of the principles that are going to show up through our different body areas and instructional sessions so that you may get the most, again, out of our in-person time. So I'm going to talk through the introduction right now, and then in class, we're going to talk through part 1 is going to focus on the ball and socket joints of the hip and shoulder. Part 2, we're going to focus on hinge joints. So knee and elbow, ankle and wrist, and associated muscles in those different areas as well. And then part 3, we're going to save kind of the best for last, so the spine. So it's a little bit more complicated, but we can still talk through the different areas of the spine. Cervical spine, which is the neck, the upper back, the thoracic spine, and the lumbar spine, the low back. And that'll kind of conclude our time together through this anatomy and physiology or biomechanics journey. So just as an introduction, I want to orient you all to some of our anatomical language. And just as you all are learning in yoga poses and practice, the language of yoga comes from Sanskrit. And so some of the terminology can be unfamiliar. And just as you're studying a new language, so that you can best communicate and everybody have an understanding of where we're coming from, the language of anatomy and biomechanics has a background within Greek and Latin root words for a lot of the terminology. And so I want to give you all a sense for just a few tips and tricks to remember some of our muscle actions given their etymology or given their origins within the Latin and the Greek. The other thing we want to do is we want to have a common language about direction and planes of motion so that when we're talking about certain muscle actions or certain cues for movement, that we're understanding that we mean the same thing, that we're speaking the same language. So our home base as far as anatomy goes is what we call anatomical position. And this will look very similar to mountain pose. So standing up, the palms will be facing forward and the arms are open. And this is kind of our baseline. So all of our movements that we describe from an anatomical perspective and biomechanical perspective will be assuming that this is our starting point, or this is our ground zero. So this is anatomical position. Planes of motion, since we have 3 dimensions of motion, we have 3 different planes in which we can move. The first plane I think of is the sagittal plane. And that is if you imagine a sheet of glass kind of cutting through the middle, splitting between the nose and splitting between the legs. And that plane of motion, I think about if you're walking and you're swinging your arms, you're moving within the sagittal plane. The other thing I like to remember, and I really like memory tips and tricks. I think it's important as you're trying to learn something, so you can plug these things in and so that it makes sense. So swinging your arms, that to me is a sagittal plane motion. The other thing I think of is sagittal kind of reminds me of the word saw. So like a sawing motion forward and back, that is also in the sagittal plane. And we can think about yoga postures that occur mostly in this plane. And we can think about our standing forward bends or standing back bends, back bend, bridges, things like that are primarily occurring within a sagittal plane of motion. Next plane of motion that we want to talk about is the frontal plane or the coronal plane. It's called either one of the two. So the frontal plane kind of goes across cuts our body into a front and a back. So that makes sense, the frontal plane of motion. Coronal, you can think of the origin of that word as corona or crown. And I kind of think about, to remember this, if you hear coronal, you're trying to remember what plane of motion that goes with. I know this is silly, but again, it's kind of a memory trick that I use, is if you think about going to Burger King and the crown they have on your head, if it's just a single plane of a crown, it's just kind of that spiky points, and that'll kind of sit on your head, and that will be within the coronal plane. So that's kind of what I think about with that. Movements within the coronal plane, just kind of an everyday movement, might be a jumping jack type motion, or kind of a snow angel type motion. Within a yoga practice and yoga positions, we're thinking about triangle poses oftentimes happen in this plane of motion. If we think about the cue of keeping your upper body at least between two panes of glass and moving within that plane, that is really characteristic of this plane of motion. Finally, we have the transverse plane, which is going to cut across and separate our body or our half into a upper section, a superior section, and inferior section. So this transverse plane kind of cuts across, and we can think about moving in the transverse plane as more of a spin and a twist. So many of our spinal twists will occur within the transverse plane of motion. Turning to look behind you, that is a transverse plane motion. Okay. Next, we want to think about what are our anatomical terms that indicate movements at joints. So if we think about our pelvis, we can have we can think about our pelvis as like a bowl. If we tip that bowl forward, we call forward anterior within anatomical terminology. And so we can call that at the pelvis an anterior tilt. If we tip the bowl backwards, we call that posterior. So that could be also termed a posterior tilt. When we're thinking about the joints above and below that pelvis and the tilt, we can start thinking about, for example, hip joints. So ball and socket joint, if I bring my leg in front of me, we call that motion flexion. So flexion forward is one way I try to remember that. If we bring the leg behind us, we call that extension. If we are bringing our knee straight, we call that extension. If we are bending our knee, we call that flexion. The ankle is a little bit tricky because we call the terms dorsiflexion versus plantar flexion. So dorsiflexion is bringing the toes up towards the shin. Plantar flexion is planting the foot, and that's how I try to remember it, and pushing off, almost like you would to come up onto your toes, rise onto your toes, or if you're pushing yourself forward in a walking motion. So this is just another depiction of the pelvis, but this is a different plane of motion. Remember, this is a coronal plane. So if we think about movement within a coronal plane or frontal plane, we can, from an anatomical position, either add that body part or bring it closer to midline. We call that adduction or adduction. Or we can bring that body part away from the midline, so kicking the leg out away from the body. And we call that abduction. So AB is the prefix that is put on that root word, and AB in Latin means away. So if we bring the leg away from the body, we call that abduction. Adding to the midline again is adduction. If we create a rotation at the joint, so for example, our hip joint, a ball and socket, and we rotate and we turn that leg or that body part in towards the midline, we call that an internal rotation. If we turn that body part out away from the midline, we call it an external rotation. So those things kind of make sense. As we travel down to the foot and ankle, we also have these motions that we call inversion and eversion. And these I think about as almost like a spinning motion. So if you think about the prior motion of the ankle, bring our toes up towards our shin. Again, that's dorsiflexion. If we plant our foot and push our toes away from our shin, that's plantar flexion. If we bring our toes in and the bottom of our foot in towards the midline of our body, we call that motion, that twisting motion in, an inversion. Contrast that to pulling the toes up and out away from the midline. We call that eversion motion at the ankle. Okay, so these are some of the tips and tricks that I kind of talked through within those two different slides. And we can apply these at all the different joints. We can talk through some of this in person as we feel it, but I wanted to give you all a sense for where some of these terms come from and what these general terms are. So flexion primarily is our shoulder moving in front of us, that's forward in front of the body. Extension, keep going back behind us, so shoulder or arm moving back, hip or leg moving back, abduction away from midline, adduction towards midline, inversion and eversion we talked about at the foot and ankle, and then internal and external rotation. So what body systems are we concerned with when we are starting to dig into anatomy and applicable anatomy to yoga? Well, I want to highlight 3 different body systems that provide significant contributors to the motions that we're going to describe and apply to some of these yoga poses. So these are 3 key body systems that help us create strength, mobility, and control. So the nervous system, first off, our control system, skeletal system, which is kind of our bony system that provides structure, but also as 2 bones come together, they form joints and we have movement around joints. So that's particularly important. And then our muscular system, which is probably the main system that you are thinking about when you think about anatomy. And our muscles contract or shorten, and they also allow for some lengthening, and that helps to create the movements that we are trying to cue within our yoga practice. So inherently within the body, we have these kind of 2 competing demands between creating stability and strength so that we don't just kind of crumble or flop, and allowing enough mobility so that we have the available motion to express. So we're not just kind of always tight, rigid, blocked. So naturally we want the optimal is to have a balance between both of those things. And different systems contribute to different functions or different allowances within these 2 categories. So within our stability category, we have what we call static stability, and that's created by these static structures that don't change in length or don't really change in the tissue properties or form as we move. So bones are kind of static, hard, rigid. Joints, connective tissues, those things we think allow a certain degree of motion, but the motion that they allow is not necessarily changeable in a short enough time frame that we can kind of see that. Dynamic stability is created, on the other hand, through muscle strength and muscles contracting or being active, and then also our nervous system control. So our brain and our spinal cord and our nerves turning on those muscles, that is part of that dynamic stability. So being able to access the strength and the actions from those different muscles. We also have what we call positional stability, which is kind of represented by, I have points of contact here, but this I think is most well represented by our balance poses. So if you have 2 feet on the ground, you have 2 points of contact, you're inherently more stable than if you only have 1 foot on the ground. You're a little bit less stable, and you have to utilize other components to keep you balanced, keep you stable. So part of our stability then, digging into that next bullet point, are these balance systems that help us give a sense for where we are in space and help us control our stability beyond those contributors I mentioned below or above, sorry. So these balance systems that are in our body help us predict and help us control where we are in space. And these 3 systems are our inner ear, or our vestibular system, kind of tells us where our head is oriented in space, and that helps us predict how we need to maintain equilibrium and maintain balance. Our touch receptors, so if you think about the pads of your fingers and your feet and the surfaces that come into contact with those, give us information so that our nervous system is able to stay on balance and predict where we are. And then our eyes, our vision. So our vision gives us input from our surroundings, and it helps us predict these adjustments that we need to make to stay on balance. So because those three systems work together to create our balance, you can think about taking away one of the systems is going to make us less stable. It's going to make our balance harder. So a great example of this is closing your eyes is a lot harder to balance on one leg. One way to leverage knowledge of these balance systems is to use gaze fixation. And in yoga, what we oftentimes call drishti. So finding a point that is fixed and using that eye focus to maintain balance is a very real biomechanical and nervous system kind of hack that we can use to create more stability within our yoga poses. So that's pretty cool, I think. Moving on to the section on mobility, when you think about joints, allowing certain degrees of motion based on how they're constructed. So ball and socket joint is inherently more mobile than a hinge joint. It just has much more degrees of freedom and ways that it's going to allow motion. I think that makes pretty good sense. So we can get to that some in the application section, but I think that's pretty straightforward. Muscle length and architecture. So sometimes within the public sphere, think about flexibility and mobility as being a function of muscle length and stretching as a way to lengthen muscles. Well, hate to be the bearer of bad news, but that's not necessarily the only factor that goes into how much mobility we have and how much flexibility we have. In fact, majority of our stretching doesn't actually change muscle length. So what are we changing? Well, I'm going to give you a nice demonstration to kind of tell you or help you experience what may be a better contributor to the amount of mobility or the amount of motion that you're able to experience. And that would be our nervous system brakes or our nervous system control. So yes, muscle length and the way muscles are put together, their architecture does allow a certain amount of mobility, but it's not the only factor controlling or limiting our mobility. Nervous system is actually more important in our control system. I put this last bullet point in here to kind of remind us that sometimes in yoga, the mobile students or the students who are able to access a lot of mobility and flexibility are praised within this sphere or this movement sector. And I just want to caution here that we do want to be careful about our extremes. So somebody comes in who doesn't have a lot of mobility. We want to be careful not to push them too far because that could be damaging just to some of the structures that are creating stability for them in a protective way. But also the individual who is hypermobile or expresses a great degree of mobility could be actually hanging out on some of their joint ligaments and other structures that we want to be careful to protect. So careful of too much mobility or too little mobility. We really do want this kind of middle ground balance between stability and mobility in an ideal world or an ideal movement practice as yoga is. So let's start by talking about the nervous system and some of the contributors of the nervous system to movement and anatomy. So this is one kind of a demonstration that I'd like you to engage in, and I'll talk you through it prior to class, and you can bring questions to class and we can go through this. But this is one example of how muscle length doesn't necessarily change, but yet we can access a little bit deeper range of motion within some of our yoga poses and our yoga practice. So you can see here, I'm in this pose where we're trying to create a little bit of a hip opening stretch. And this is one way to gain mobility, and this is with a contract, relax stretching technique. So what I'd like you to try, and you can pause the recording here, get into this position. And what I'd like you to do is I'd like you to press your knees or your thighs up into your elbows and engage in what we call a contract, relax stretching technique or mobility technique. So you're going to push into your elbows, and it doesn't have to be 100% push. It can be about 75% effort. You're going to push into your elbows for about 5 seconds, and then you're going to relax and push down with your elbows and see if you can open those hips and stretch and allow a little bit more movement through the adductor muscles as well as the hip joints. So I'd like you to engage in that practice. 5-second contract, 10-second relax for about 6 to 8 repetitions. And as you do that, what I'd like you to try to be aware of is, do you gain some degree of flexibility, some degree of motion? And I would imagine that you do. So this illustrates the first point in that our nervous system, or our ability to tap into certain amounts of control, and this technique comes from a domain of movement practice, or biomechanics that we call proprioceptive neuromuscular facilitation, or PNF stretching, contract-relax stretching, that we can really utilize to kind of leverage and take the brakes off our nervous system. So our nervous system is going to kind of protect, doesn't want us to injure ourselves, so it's going to kind of create that tension. But sometimes it creates the tension before the point of us actually being able to injure anything. So it's a little bit maladaptive. So again, contract relax stretching, that's one technique. This is another technique to kind of leverage or demonstrate how much our nervous system contributes to our allowable amount of mobility. So in these 3 different forward bend positions, you'll notice that the first one, my feet are flat on the floor. Second one, my heels are kind of propped up on this little bolster, and it's just a couple inches pad. And then the third position, my toes are propped up on the pad. So this demonstration, what I want you to start off with is just your normal forward bend, and just see how low you can go and how that feels on the back of your body, on your hamstrings, how it feels on your back, how it feels through your ankles, and just kind of take stock of that. The next thing I want you to try is I want you to do 15 forward bends, just gentle. You can do sun salutations if you want to. You can go through a whole series. You can go through a flow if you like to, but at its basic, what I want you to do is just the 15 forward bends with the feet flat on the floor. And then I want you to repeat that in each of these different foot positions. So 15 forward bends with the heels propped up, 15 forward bends with the toes propped up. And then I want you to revisit that starting pose, or that starting forward bend. And I think what you will find, again, is that you have the ability to access a little bit deeper range of motion. So your hands come closer to the floor. Maybe your fingertips were touching, and now you can get more of your palms on the ground. And again, what this demonstrates is we did not, within that 3 minutes, 5 minutes of practice that you just did, we did not change your muscle length, your hamstring muscle length, or other muscles for that matter. But what we did do is we kind of warmed up your nervous system, and we accessed what we call movement variability to kind of teach your nervous system that that movement was safe. So again, it kind of takes the brakes off and allows you to access a little bit deeper range of motion. So that's a really nice demonstration, I think. Okay, finally, this next demonstration that I want to provide is the ability to gain stability at certain joints with intentional and attentional muscle activation. So in this particular posture, in Warrior 2, what we want to think about is what are some of the principles of the joints, and how do we create stability at those joints in different positions? So when our foot or our leg is in front of us and our hip is in flexion, what we know about that hip joint is that in order to create stability, remember it's a ball and socket joint, so it's inherently more mobile, but in this position, we're using our legs as our base of support. We really do want to create some strength, and we want to create some stability through this posture and through our lower body. So one way to do this is to actively engage the deep hip external rotators of our leg that's in flexion. So our front leg in this position. So what I want you to do is come into your Warrior 2 and actively try to screw that foot into the ground. So don't change where your foot is. Don't actually spin your foot out, but try to grab and try to spin and screw that foot into the ground and wind out or externally rotate at that hip. And what I think you'll find is that provides some added stability to this front leg. The back leg, because of the hip joint morphology and because of how the muscles are oriented in the capsule, we want to create stability by internally rotating at the hip. So that back leg in your Warrior 2 position, we want to spin that leg in towards your center, or spiral that back leg in and create an internal rotation. And again, what I think you'll find is that those cues and that stability through the lower body is created with this intentional muscle activation that's predicated on what we know about the anatomy and the biomechanics of the joint. So again, we're going to talk through some of these principles when we meet together in person, but this is just a demonstration to give you a sense for how these principles can kind of be applied. Okay, so let's talk a little bit about our skeletal system and the joints, so where bones come together. So what I want you to keep in mind is these functional anatomy concepts. And some of these concepts, and one particular concept called the joint by joint approach, comes from an individual by the name of Michael Boyle, who's a strength and conditioning specialist. And he has this book called Advances in Functional Training. He has other books and other writings, but this approach or this kind of theory talks about the idea that if we lack movement at a certain joint, we will have to move more, or we'll have to compensate at the joint above or the joint below. So our joints don't just work in isolation, but they work within our whole body. So if we have limitations at one joint, our body's going to do the movement that we tell it, or our body's going to do the pose that we tell it within our yoga practice. We have to be careful about that, because if we are lacking mobility at a certain joint, then we might try to pick up mobility at another joint, and that could create some compensation or discomfort because we're moving excessively the joint above or below. So common manifestation of this, if somebody's lacking in ankle mobility, they could end up with aberrant movements at their knee. Their knee could come in, come out. Their foot could spin in, spin out. And that could cause some pain or discomfort. So just trying to be aware of that. And as you're cueing an individual within these yoga poses in the yoga practice, understanding that each individual's pose and the health of that pose is going to be different. So it doesn't have to be a perfect ideal, because we're constantly working on improving our movement systems. But what we don't want to do is we don't want to provide such rigid cueing that they end up with these compensations. The other thing that we want to keep in mind is that certain joints have just certain inherent capabilities to them. So we started talking about this, and the idea that the ball and socket joint just has a lot more degrees of freedom or ways that it can move in healthy ways. Our hips, our shoulders, versus our hinge joints work more like a hinge. So they open and they close, and they move more in one plane of motion. So our knees, our elbows, they don't have a lot of rotation at them. They move mostly in a flexion and extension plane. Same thing with our wrists and our ankles. And then our plantar joints, which mostly, when I refer to plantar joints, what I'm going to talk about in this course are joints of our spine. And we get sliding and gliding motions mostly at those joints. They can express different degrees of stability and mobility. So they're more in the middle. They don't fall on one extreme or the other like these other two types of joints. Okay, so to kind of further go off of that principle, the joint by joint approach, but then also how some of the joints work, we can think about different positions of stability that are created at these different joints. So hinge joints have the most stability at their end ranges. So either fully straight or fully bent. We can create a good amount of stability. So you can look at within this pose warrior one that I'm utilizing, straight elbows, straight wrists. Those are pretty stable positions of those joints. Ball and socket joints tend to have stability within their end ranges in any direction, but they just don't have quite as much stability. So just like in the prior example with our nervous system, where I'm trying to create external rotation or internal rotation at the hip, that wind up and that muscle activity is really how we're going to create the majority of our stability at our ball and socket joints. The plantar joints of our spine are really most stable in extension. We can think about stability created in the spine at other end ranges of motion, but just as a general rule, extension is going to be what we call the closed pack position of those joints. And so those positions are going to be the most stable positions. And that would be like a back bend motion. That would be extension of our spine. Okay, so the last little orienting part I'd like to talk about is the muscular system. So you might be thinking, save the best for last. Well, yeah, here we go. Muscle system. These are our movers. And we have different types of muscles. So we have muscles that tend to be more of the movers. We call these phasic muscles. So these types of muscles tend to turn on, turn off, depending on if we're trying to engage in a certain movement. So for example, the hamstrings muscle group, which create hip extension and also knee flexion. So if we want to bring our leg behind our body, we can engage our hamstring. If we want to push our hip up towards the ceiling in a bridge, we can engage our hamstring. Pull our heel up towards our butt, we can engage our hamstring. But they're not necessarily on or firing that much in a resting position. This can be compared or contrasted with our muscle stabilizers. We think about these stabilizers more as our postural muscles, our core muscles, and they're sometimes referred to as tonic muscles because they have kind of a resting level of tone versus the phasic muscles have like an on and off phase, is how I remember that. So for example, these can be our core muscles, our paraspinals, or some of the core muscles, or the stabilizer muscles in our back. The other principle that I want to bring up is one that comes from this wonderful book on functional anatomy called Anatomy Trains that really looks at muscles within their connections with fascia, ligaments, tendons, and movement around joints. But it talks about them in more of an elegant way that is not as isolationist because, as we know, muscles don't work in isolation. We do these big movements and the muscles have to work together, and they're always tugging and pulling on their connections, like their fascia, their tendons. So this principle of tensegrity and stability through tensegrity, the reason I bring this up is because this is how we're going to utilize an understanding of creating stability or dynamic stability with our musculature. So this really says that the tensions created from those muscle actions or the muscle pull is part of what creates the majority of our stability. It's not just our bones mashing together. That would be it's kind of too simplistic, and it also assumes that the compression force is the only thing that creates stability, and we know that's not true. So pulling yourself deeper into a forward bend, creating that active tension and that intentional tension and that pull can create stability. Okay. So also within our muscular system, we want to talk about different types of muscle contractions. This is particularly important because we can think about our muscles as contracting. And as they contract, they pull the two attachment points on the bones closer together and they shorten. That's the main muscle action that we think about as we're describing what our muscle function is. So that's the easiest manifestation to kind of understand. So that would be what we call concentric muscle contraction, is the muscle contracts, it pulls together, and it shortens. So if we're thinking about an example of our hip flexor muscles, and remember flexion is bringing that hip in front of our body. So an example of concentric hip flexion, those muscles shortening, could be in this picture of the sprinter. So bring the leg up in front of you, like in a run or in a sprint. In a yoga pose, this could be just lifting the leg in front of the body to move into a pose like a tree pose. Contrast this with the muscle contracting, but not actually performing any movement. So the muscle is really engaged. It's working really hard, but there's no movement created. That's what we call an isometric muscle contraction. Iso meaning same, metric meaning length. So the muscle stays at the same length, doesn't actually change in length. And one thing you can think about here, the hip flexor isometric, could be something like a dancer pose or a bow pose, where you're kicking, actively kicking really hard. You're using those hip flexors, you're kicking into your hand, but you don't actually move. So you're using the muscle, but it doesn't shorten. It doesn't change in length. And finally, we can describe what we call an eccentric muscle contraction. And this is where the muscle lengthens, but it's a controlled lengthening. So it's not just falling back to a resting length, but it's a controlled lowering is what we can often describe it as, because we are controlling, for example, the force of gravity acting on the limb. So this could be coming down out of that tree pose. So lowering that leg back to the ground would be an example of the hip flexor performing an eccentric muscle contraction. Okay, so an upper body example of these different types of contractions could be manifested in kind of this push-up position or chaturanga. So we can think about the triceps and the pectoralis major muscle groups as performing a pushing motion or shoulder flexion, shoulder horizontal adduction. So the concentric muscle contraction, those muscles shortening, would be pushing up out of a push-up for the triceps and the pectoralis major. An isometric, where the muscles are not changing in length, would be just holding a plank position. There's no change in length, but they're controlling that position of the body. And then the eccentric component, or a muscle, the triceps and the pec major lengthening, but a controlled lengthening, would be the lowering phase or the lowering portion of a chaturanga, lowering in the bottom of the push-up position. So as we know in yoga, holding a pose, so slow and controlled holds are oftentimes very difficult. And that's just a representation. I want to bring your attention to this idea that isometric muscle contractions can be a lot of work. And so cueing muscle activity in certain positions to engage in dynamic stability is particularly important in our yoga practice and in how we cue poses. Okay, so the last little bit, just as a preview before our in-class session, about how this is gonna work or what I wanna highlight is we wanna focus on our in-person courses on muscle groups instead of muscles in isolation, because I feel like that is gonna be the most applicable and the most functional to you all as instructors. And they're easier to remember as groups. So oftentimes muscles are named, and this kind of gets into that second point, on the actions that they perform, where they're located, and what they're next to. But if we think about muscle groups and group them based on actions, we can talk about the hip flexors as a group, extensors, abductors. We can also talk about groups that kind of live together. For example, a quadriceps group in the front of our thigh, hamstrings group. And I have 4 muscles here, and that might be thinking, oh, I've only heard of 3 hamstrings. Well, yes, biceps femoris, semimembranosus, semitendinosus. And sometimes we actually include the adductor magnus. It has, part of that muscle has an attachment on the ischial tuberosity. So we kind of, sometimes we'll call that the hamstring portion. And that's why I say there are 4 muscles here. So I don't mean for that to be confusing, but that's why I have that. And then the calf muscle group, abdominals, shoulder internal, external rotators, etc. So we're going to focus on those groups. Not that we're going to name, let me back up. We are going to name specific muscles, and I'll kind of give you a reference point for what muscles fall within these different muscle groups. But I'm not going to spend a whole lot of time on the muscles in isolation. If you want to talk about that, we can discuss resources for further study. And I can go into some of that in our in-person section if you have questions on it. But I feel like our functional components of anatomy are better demonstrated by these muscle group focus. Okay, next thing I want to give you all in class is some tips and tricks for remembering muscle names. So again, some of these muscles are named by their actions. Some of them have names that relate to the anatomical structures that they are nearby. For example, the tibialis anterior muscle in the front of the shin is by the tibia bone, it's by the shin bone. So that kind of makes sense. And anterior means front. So the muscle on the front of the shin bone is the tibialis anterior muscle. Kind of makes sense. So if you know some of those principles, naming of muscles is a little bit easier, and the remembering of them is a little bit easier. And the location on the body, that's kind of the third point. and is demonstrated by the example I just gave as well. Final thing that I want to give you is just some recommendations for resources for further study. So highly recommend picking up a good anatomy atlas. And this is kind of like your dictionary. This is kind of like your reference book where you can just look up different muscles. This isn't a book that you read cover to cover unless you want some good fall asleep reading. But this is a really nice reference manual to have. And the pictures and the 3D representations of muscles, joints, and their relationships are just quite neat to have as you start to dig in some of this anatomy, science, and learn more about the human body. These are some recommendations that I have that I think are quite good atlases. The Grants atlases, I would recommend probably first off. And so they're in the left pictures here, there's the 13th edition, there's a 15th edition. 13th edition is pretty affordable. So you can pick one up secondhand for about 15 or 20 bucks online. The other two atlases that are quite popular are a Netter atlas, and he is a doctor who has some quite beautiful illustrations of the human body. However, some of those atlases from Netter don't have as much terminology within them. So that would be the reason I really like Grants. And Grants has some nice muscle charts and actions in there. And then Gray's Anatomy is another kind of classic anatomy text. Okay, and that brings us to the end of what I want to describe as our introduction and a nice jumping off point to when I see you in class.